So let me just tell you a few things that we can do here at the office. So when I'm looking at my patient, when you come in for your in-person in your CBCT or your big 3D image of your head, I'm looking to see the size of the garage. And the garage is your jaws. And the Hummer is your tongue. I've had some patients go, can we make the car maybe a little bit smaller? No, it doesn't really work that way, but you can make the garage bigger. Patients in clear aligner trays to help kind of widen that garage and have had really great success with just orthodontics, just moving teeth, making that garage bigger. And that's all that some patients need. Some patients don't need that. Their jaws are already big enough, but anatomically, the airway hole in the back is not. So sometimes those need to help pull the jaw a little bit forward to get this airway open in the back. And that's called an MAD device, or a mandibular advancement device. Sometimes patients need both, because sometimes the garage is not big enough and the airway in the back is still not big enough after even getting more airway space in the jaws. The other thing is why you need to have the jaws to get a little bit bigger is to park that Hummer in there. And so sometimes we can get the garage bigger, but the Hummer still doesn't fit completely, and you need to pull that jaw a little forward for the Hummer to have more space. Or even just teaching patients how to properly place their tongue. Sometimes their tongues are tied and they can't get their tongue up and out of the way to open that airway space. So we evaluate those things as well and have treatments for that also. Sometimes the patient is just a really bad snorer and maybe there's no actual obstruction. There's no actual stopping of breathing while sleeping. And so I have a laser treatment that actually helps to tighten the collagen up in the back of the throat so there's more opening. And that is a very minimally invasive procedure. You hear laser and you think, oh no, don't even. But it's actually very, very quick. It is a 3-step process. We like to see every 3 to 4 weeks to help tighten that tissue. It feels like Pop Rocks, if you will. You have a little bit of sore throat at the end of the day, that one day. Take some Tylenol, Advil, eat and drink just like you want, and then it's typically gone the next day. That has been very, very helpful to decrease that snoring, sometimes taking it completely away. So there are many, many things that I look at when I have my sleep consults. Like I said, not everybody qualifies for everything, but there's a lot of things I take into place on what will work best for my patient. The other thing is we'll just sit and we'll talk about it. It's your mouth, it's your sleep, you get to choose what you want to do. So in that sleep consultation, we'll kind of discover together what do we think is the best thing for you, and then proceed down that treatment route. I hope that answers lots of questions for you, and I look forward to seeing you in person.